Well, at this very uncertain, unprecedented time, school reopening is causing a lot of stress. We know that it's causing anxiety, and we have parents calling the newsroom, emailing us questions. And that is why this virtual town hall seems so important, because we want to address some of those anxieties and maybe come up with some solutions and some guidance. I appreciate you all being with us today. I want to introduce you once again. Carla Collins is joining us. And Carla, if you can wave. Carla is a second grade teacher at the Liberty School System, and she's also a parent. Amy Smith, she is a parent and mom of 4 who go to the Boardman schools in various school buildings. We have Superintendent Pete Perrone. He is the Struthers City School Superintendent. They have announced some plans already, I believe, and he's going to be sharing some of that. Ricky Queener is joining us. She is a parent of kids in the Youngstown City Schools. Youngstown has already said they will be doing remote learning. And Dr. Frank Esper, he is a pediatric infectious disease physician with the Cleveland Clinic, also researches new viruses, novel viruses of respiratory, I should say of respiratory, what would you say, Doc?
They're all respiratory viruses. There's hundreds of them, but obviously we're talking about the coronavirus today.
Okay, excellent. We're glad to have you. And Ohio Education Association, Scott DeMauro. I just gave you a new title, Scott. Scott DeMauro, thank you so much for being with us as well.
That was the easiest PhD that anybody's ever earned.
Exactly. Yeah. Let's start with, what is on your mind. I'd like to go to Ricky, if I can go to you first. Youngstown has spoken out and said they will do all remote learning for students this coming fall. And what are your feelings about that? I'm sure there's a lot of anxiety about knowing that they'll be at home.
Yeah. Well, there's mixed emotions, of course. Anxiety, knowing that they will be here and their learning is my responsibility, as well as working from home, continuing to do that with children. It's not always the easiest pie day, but it's the mixed emotion of knowing what I have to deal with. But I'm happy that I know what I have to deal with and that I'm able to say, okay, my school is starting remote. Let me wrap my head around getting a schedule together for our day, making sure I have all the utilities, the things I need at home, the tools, the pencil sharpeners, everything that I need at home for them to have a good year. So I'm happy about that I know that I'm starting remote.
And ahead of time.
Yes, and regardless of how I feel, I'm able to start a plan and put my feelings to the side and get something in motion.
Thank you, Ricky. Amy, can I go to you? What is on your mind as you prepare for children to go back to school, one of which is going to be a senior?
Yeah, definitely he's ready to go back to school and he wants to go. I asked him before we hopped on. Obviously, he doesn't want to miss out on a lot of his laughs. Like you said, I have kids in 3 different buildings, which gives me 3 different issues. The oldest are pretty self-sufficient. They're in high school. They weren't too difficult, when we had to jump into it in the spring. It was actually my junior high student that had the hardest time emotionally. They really, really like that interaction with their teacher and the instruction that they get that I'm not qualified to give, quite frankly. I do have a master's degree, but not in education. So that was a complicated part of it. You've known me for a while. I know, I like structure, I like schedules. So we really don't know what our school year is going to look like. We don't know if it's partially remote, fully remote, or we're going to go full in and try to go to school full time. So that little bit of the unknown is a little unsettling right now because it's coming fast.
The unknown. And Amy, if you could come a little closer to the computer for your audio, just to be a little louder. Thank you.
You got it.
Amy said something that I think we've all said, the unknown. Carla, that's something that you're dealing with as you prepare to transition back to school, not only in terms of sending your kids, but teaching, right?
Right. So I 100% think that kids need that face-to-face learning, and there are a lot of gaps that these kids are going to be coming to us at. So they're already like, we're having to dig them out of a hole to begin with. And they definitely need that sense of normalcy. But as a teacher, from the teacher perspective, there's so many puzzle pieces to think about. So I think figuring out how to make sure that each puzzle piece of this, whether it be, you know, how are the teachers going to be safe? How are the parents going to be safe? How are the kids going to be safe? What happens if this happens? What happens if this happens? There's just so many things to consider, and that does cause a lot of anxiety.
Superintendent Perrone, can I go to you for a moment as you hear what the parents are saying, and a school teacher, I'm sure it's very similar in your district.
And absolutely, and I would speak to all the parents. I mean, obviously I'm a parent too of two school-age children. Every concern that the parents are asking are the same concerns the superintendents have. You know, we have a tremendous weight on our shoulders of keeping, you know, 5-year-olds safe all the way up to 65-year-olds safe who work in our districts. So we have those same concerns, and we're asking those same questions to our public health in Mahoning County and at the state level. So we understand the concerns of the parents.
Scott, if you could speak on something that Superintendent Perrone just mentioned, they have to protect the teachers and the students and the community at large. Your concern has been in the past that some of the teachers who could be vulnerable are in positions where they could be very, very close to contracting this virus if there aren't proper safety measures, right?
Yeah, certainly. I mean, I think I just want to echo first what Carla said, and that is that, you know, our members, and the Ohio Education Association represents teachers and education support professionals who perform a variety of roles, from bus drivers to school secretaries to cafeteria workers, paraprofessionals. And what I hear consistently is that everybody is really, really interested and wants to get back to the school year and connect with their students. We care deeply about the success of students, but we want to make sure that when schools open, in whatever form that takes, that people are going to be safe. And I'm really interested in hearing more from Dr. Esper about this, but what I've been seeing more and more, especially over the course of the summer, is that I think earlier there was this notion that this was a concern just about the adults, but the kids were going to be fine and there's no reason to worry about kids getting sick. You know, I have a colleague of mine from my home district in Central Ohio who's been dealing with 3 of her children who are COVID positive, who've been quarantined for the last 2 weeks, 19, 18, and 8 years old. And I'm hearing more and more stories of our members who, and a lot of them are not necessarily older and not necessarily sick, who are finding that they're being exposed, and this virus is taking all kinds of unexpected twists and turns. So we want to make sure that however school opens, that health and safety is of the utmost priority. And part of that planning, and I appreciate everything that the parents on the panel say, and my children are college age, so we have different kinds of challenges that we're facing with that. But I know that people do want to be able to plan. Part of that is planning for the reality of remote learning if and when it's necessary. And I know that there are a number of districts that are delaying the start of school because of, you know, being located in a hotspot county like Mahoning County. I know that there are a lot of districts that are planning for some kind of hybrid approach to the school year. But we have to be prepared that depending on what happens, we may all have to, at one point or another, go to a remote learning situation. And that means we want to make sure the teachers are well prepared, the parents are well prepared, and the students are well prepared for that.
Superintendent Perrone, you raised your hand.
Yeah, I couldn't agree more. And obviously we need to be prepared because, listen, any of our plans can change tomorrow. I think one of the most important things that we're doing is we have reentry committees at the district level, at each building level, and the importance of including our teachers and including our support staff in the planning, I think is probably one of the most important things, as well as hearing from our community. But I think it needs to be a team effort in how we're going to open our building safely.
Dr. Esper, can this be done safely, reopening schools this fall?
Well, that's obviously what's on everybody's mind right now. And listening to everything that's already been said, there's a couple of things. One is just the uncertainty, that a lot of people have expressed, and the concern that goes along with that, as well as the recognition that things have been changing on us ever since this virus came out back in February, March. This virus has been throwing curveballs, and recommendations early on have turned out not to change, or to have to be adapted. And we, looking forward in the future, we've seen what all the changes we've had to make and all the things that we said initially and then had to change subsequently that we've done over the last 6 months. We are probably going to be doing that again. We're still learning a lot about this virus, and as I've been telling everybody, it's like we're in the middle of the game and we're still learning this virus's playbook. It's not the best way to go through a pandemic, but this is unfortunately what the cards that we've been dealt. What I would say is that there are still some truths that have been holding steady in how we're seeing what this virus wants to do. Talking to what Scott brings up about how what age groups have been affected, we're seeing more and more younger age groups becoming recognized as being infected. However, the disease itself is still primarily in the older age groups, are still primarily in individuals who have underlying problems with high blood pressure and diabetes, etc. But we are seeing more and more children and more young adults that have been affected by this virus. We've never said that children were off the hook. We've always recognized, and I think everybody here who is a parent knows how a bad virus can go through and cause, problems in children, problems in young children. A lot of times they get better, and with this virus, we've seen that in a majority of those children who are, under the age of 20. But what we are seeing now is we're recognizing is that younger adults in their 30s and 40s, which honestly is a large population of school teachers, staff, that they also have to recognize that that they can get sick, and we do have to understand that children can get sick. But thankfully, if there's one redeeming quality of this virus, is that it doesn't cause severe disease in young children many or a lot of the time. But it's not that they can't; it's just that they don't very often.
Superintendent Perrone.
Yes. And again, as we said earlier, that's the concern of, as a leader, you're not planning for one age group, you're planning for multiple age groups, and how to keep everybody safe, but still how to continue the education. And it's tricky, obviously the more we can track and learn about the disease helps make our plans a little bit more safer. So we're always interested to continue to hear from the medical experts about the coronavirus.
Ricky.
Well, I kind of want to backtrack and double back a little bit. Back to Carla and her situation of multiple children or multiple districts involved. And I want to ask Dr. Esper, what is the plan? So my district is going remote. We're starting remote. That's what we were told. We weren't told it would be all year remote. So I'm looking forward to more information from that. But I want to know, how do we keep the kids safe and the parents safe and the staff safe when there are so many people that interchange counties, districts, and everything of that nature? Like, it's a completely interwoven system. My district has a lot of transient students where I have students just moving from sides of town. where, you know, just the rules within the schools themselves need to be kind of on the same plane. But I'm asking Dr. Esper, what is the plan that you know of so far for the quarantine situation, basically? How do multiple people have to be quarantined for if somebody is exposed or is test positive?
Carla, did you want to add on to that? Sorry.
Do you mind if I add on?
No, go ahead. Yeah.
So being the teacher that I am, I made sure I typed out some points I really wanted to make sure that I got out that have really been wearing me down, and I exactly agree with what you're saying. So for example, my husband is a teacher. Say he were to get sick, do all his students quarantine? Would that mean that I would have to quarantine? Would my personal children who go to Girard have to quarantine? And then would all the kids in my kids' classes have to then quarantine? Like, where would the chain end with that? And then with that said, like, should I have, like, would you recommend, since my kids are going to be exposed to all these different school systems, my husband teaches high school, I teach elementary school, would you suggest them, my personal children, learning virtually? Because that kind of, I almost feel like I'm being, I don't know what the word is, not disrespectful.
Have to make a choice between.
Yeah, like, but almost being like uneducated, or I can't think of the word, but sending my kids to Girard knowing that they potentially could be carrying the virus just because we're being exposed to so many different kids. Like, irresponsible, I guess is that irresponsible for me to send them to their classroom? What are your thoughts on that?
Doctor?
Okay, a couple of points there. One, no one is being irresponsible here. The answer is that there is no one-size-fits-all solution to this problem. A lot of each district, each school system has a certain amount of resources, certain amount of capabilities, a certain amount of space, certain amount of things that they can do and they can do. And it very well may be different between school to school, from district to district, and place to place. And I know that each and every one of them are working very hard and to do what's best for their children. And the staff that they care for. What I will say is that also, though, when you talk about all the different children, you're going to have to make basically a family decision. You can't have two children in your house distance learn, and three children in your house going off to school. All right, it should be either everybody goes to into school or everybody stays home. If you send several kids out and have two kids home, it just doesn't make sense. You're going to still see that an exposure, and you're probably defeating the purpose of the home learning, of the distance learning, by having other children go out. So you have to decide how many, what type of system you're going to do. If you have one or two children, it might be easier. Some of us with 4 or 3, or me 5. We all we have to make these types of decisions, in a group. You have to look also about what's your risk threshold. Do you have someone who lives in your household who is at high risk? Is there someone in your household, is it grandparents that you're living with? Or is there someone with an immune issue or underlying lung issues that can get really, really sick? You have to make those decisions, but those are a family decision. Now, when it comes to who stops and who, if who's exposed, who's not exposed, who quarantines, who doesn't quarantine. In general, while contacts of people who get sick are encouraged to stay home, all right, contacts of contacts do not. So if someone is sick and your child, your child is, exposed to that person who did get sick, that child probably should stay home to see and watch. But the other members of the family, unless that child actually gets sick and gets symptomatic or has fevers and cough, etc., the family members do not need to quarantine. So contacts of contacts do not need to quarantine, but those contacts of the individual who is found to be infected should. I hope that helps.
Amy, did you raise your hand? Yes.
I did, yes. I did. Just to kind of build on that, I'm glad you said that, because my family actually did get tested. A friend of our son tested positive, but he was asymptomatic. So we all just went and got tested because he spent a lot of time with him. So it's good to know where you draw the line. Like maybe he just needed to be tested and he needed to be, kind of quarantined a little bit rather than the rest of us. But I do have 2 children that have asthma, which we usually are very cautious with when there's a virus. They've been hospitalized from viruses when they were younger. And I have 3 who have a life-threatening food allergy. So we've always lived a little cautious, and maybe it's naive of me to think that I would live the same way with this virus, basically. And maybe you can expand upon that, just because we've always had to live cautiously, wipe things down, watch what we eat, try to avoid, certain situations, but yet they're very active kids. So we don't want to take away a life from them just because they have certain, health concerns. But also, is it, if so-and-so is carrying it, at any point in time, anybody we're around could be carrying it. So just staying home and participating in only certain things even makes sense. Like they go to sports, but they don't go to school, if that makes sense.
Thank you.
Yeah. Yeah, if I can answer real quick. Yeah, that is a good point. Whether or not, not just do half of them, do you stay home and do distance learning, but then you go off and do travel sports. At that, in that situation, I think it's kind of the same thing as, exposing yourself to a multitude of other children and their parents and their families, as everybody also goes to these events. Especially if they're enclosed. Remember, this virus loves enclosed spaces. Outdoor events are a lot safer than those that are held in an auditorium or in an arena, especially when you're sitting in one place for a long period of time. That's kind of what this virus would love for everybody to do. There is no recommendation by the American Academy of Pediatrics or the American Lung Association that I'm aware of that says children with asthma should not go to school. It is well recommended, though, that the American Academy of Pediatrics, the Cleveland Clinic, at our division and Center of Pediatric Infectious Disease also agrees. Centers for Disease Control, even the Ohio Department of Health, do understand that it is better for children to go to school. It is healthier for children to be at school, just because it's not just the learning environment is better, but it's also there's a lot of other things that these children need from an emotional support, from development of their maturity. Some of them helps with food, as well as mental health. All these support systems are in place at school, and we understand that a school environment is the best. The issue right now is when and how can we make sure that each of the schools are as safe as possible. Nothing is 100% safe, guys. Even staying at home is not 100% safe. You guys, so there's always going to be some level of risk. It's exactly when do the benefits outweigh the risks, or vice versa, that we have to make a decision for getting kids back into school.